We'll now open our panel on what happens after birth, creative ways of integrating care of newborns and their parents. I'm happy to welcome Dr. Yossi Azuri, who will chair the panel. Yossi has been a family physician and diabetes consultant for Maccabi Healthcare Services for over 20 years, and he is the chair of the Institutional Review Board of Maccabi Healthcare. He is also a lecturer at the Tel Aviv University Faculty of Medicine, where he has been teaching medical students, interns, and residents for the past 15 years. He has published over 40 scientific papers and serves as a member of the Ministry of Health National Council of Health in the Community. His main research fields are health promotion in the community, patients' health beliefs, and the use of computers in medicine. Yossi?
Thank you, Irit, for your kind words. During the past 2 days, we actually heard a lot about the quest for parenthood. We heard about the prenatal concerns and paths for parenthood, towards parenthood. And today we hear a lot about the birth of new parents, the birth of new families. As a physician, I tried to look yesterday just to see what the new parents need to do during their first year as new parents, as new families. So I summarized it in a few words, just so I won't forget. So according to the Ministry of Health, according to the Israeli Ministry of Health and the Israeli Task Force, the new baby should be screened for 12 medical conditions and inherited diseases right after his birth, and he's about to receive about 6 various vaccines in 6 separate visits during the first year of life. The new family should be advised to visit the pediatrician for 2 to 3 times and the community nurse for an additional 6 to 12 visits, separate visits. The medical staff is also advised to discuss dietary issues such as breastfeeding, gluten, cow milk, egg consumption, vitamin consumption, supplements, exercise for the baby and family, sleep issues, ultrasound for the hip, and the hemoglobin blood test, and etc. And this is only a partial list. So, wow, it's actually quite a lot for the new family. And this is only for the medical staff, not including the family, the friends, what they see on the supermarket, at the playground, and etc. So I guess there's a lot for the new family to deal with during the first week. So with this, I would like to begin our session. And I would like to invite Dr. Tzipi Strauss, which will talk about the power of words relating to parents and preterm babies at a neonatal ward. Dr. Tzipi Strauss graduated both the Faculty of Medicine and Healthcare Management. In 2010, she was appointed Deputy Director of the Children's Hospital of Sheba Medical Center, and since 2012 has served as the hospital's Director of the Neonatology Department. A member of several committees in the Health Ministry and the Neonatal Association. She is currently a senior lecturer in Tel Aviv University. Tzipi participates in international conferences and publishes in international medical journals. So Tzipi, the floor is yours.
So first, thank you very much for inviting me here today. I want to apologize because somehow it's my mistake. It wasn't prepared in English, but only 2 slides are in Hebrew. This is the first, and there is only 1 slide, which I will of course translate, so apologize for that. So, what do you want to be when you grow up? This is a question most of us, all of us, heard, and usually most of the answers are, I want to be a pilot, an astronaut, usually doctor, usually fireman, usually it's persons with some kind of uniform. There is a halo of uniform professional. And I remember the first time I was introduced to a physician, a uniform. It was when I was 12 years old. I went with my father to the ophthalmologist because I didn't see well from the board, and she examined me, and she was looking at my father. I was 12, and she said, well, she will need glasses. And I was in shock. I was like, what? I'm not going to wear glasses now. And it was like, she didn't even look at me. She's telling me the worst ever decision that I will need to change, and there is not even like eye contact with me. And I remember that at this point I said, I will be a doctor and I will not be like that. And I think this is when I realized I want to be a physician. So actually I became a physician and I became a pediatrician, and then I became a specialist in neonatology in preterm babies. And for 20 years I'm already dealing with children and babies, and for the last 6 years I'm the director of the Department of Neonatology in Sheba Medical Center. And of course we are treating medical-wise, intubation, chest drain, sepsis. We treat babies 500 grams. We treat babies with congenital malformation. We are actually one of the biggest department in Israel. But during that time, the last 5 years I was thinking and wondering, what is really our job as physician? So, of course, some will say, well, we want to be George Clooney, or maybe find a husband like George Clooney. Actually, many wanted to be a pediatrician after ER because he was a very nice pediatric doctor. However, I was thinking, really, saving life is usually the answer. Okay, of course we want to save life, but it's not only that. We are in a position that saving life is quite obvious. So I was looking, and this is the second slide in Hebrew, and I'm sorry for that, but this is the Hippocrates Oath. So I said, let's go back. When we are finishing medical studies, we all owe to the Hippocrates Oath. And I was reading it, and it was actually very interesting. 20 years ago, I was saying it and got my degree. And when I read it now, and I will emphasize several words, here it's helping a person whenever he is sick. You have to understand the soul and the mind of the patient to improve his mood in the ways of wisdom and love of humanity. Give honor and respect, and don't say a word or don't phrase your word cautiously, and be aware of what you are saying, and try to say it wisely. And I actually was amazed because there is nothing here about giving the good diagnosis, doing a good surgery, preventing sepsis, infection, whatever. It's mainly emphasizing what we are as a person, being a physician, how we are connecting with the patient that needs us at the most extreme situation. So going back to our neonatal intensive care unit, our NICU, and this is the way NICUs look like, okay, most of the world, and also in Israel and many other places that I go. It's usually a whole big room, one big room with many incubators stand one near to the other. It's very noisy, it's sound, the environment is not really relaxing, and it's a very stressful situation. And in this situation, these babies are in. I mean, they are born ahead of time, and now with all the medical situation they are in, also the parents are, of course, in a lot of stress. And 10 years ago, there was a psychologist named Alice in Boston, and she started to look on these babies in the NICU and the parents and the interaction between the parents and the babies. And it looked not okay, let's say. There was something not really relaxing, nourishing about this environment. And this is the environment we want. This is the environment, and these are NICUs that are being built now, and we are planning to build one in next year. We are planning to start for a NICU that will look more like this and more environmental supportive. Now, why is it important? So if we are looking on our brain and how it develops, so this is a brain of a 25-week, which, as you see, is completely straight without these cortical foldings, which are important and crucial for the development of neurodevelopmental of a child. And as you see, we'll continue through the weeks until term. And adult, supposed to be a lot of cortical foldings, and this is what's important for our normal development. What Terry Inder in Boston, what she did is doing an MRI every week to a preterm baby that is born and now in a very stressful situation. And what she found out, that looking at their MRI, there is a decreased frontal lobe width on babies that were in a lot of stress. And if you look at the temporal one, which is here, temporal lobe is lack of sulci. It's really not developed. And this she saw not only in babies that were in a lot of stress, but also the opposite. Babies that were sensory deprived, babies that didn't have the mom or the father to hug them, to be with them, to nourish them. So it goes both extremes. And also the connectivity, the connection between the right lobe and the left lobe was harmed. And if you see A is a normal term baby, B is a baby that was mildly stressed, and C is a baby that was in intensive stress. And stress, when I'm talking stress, is pain, procedure, is obnoxious noise, is alarm, all these that we see in our NICU and the babies unfortunately need to go through. So then it started all the idea of the importance of the connection. So of course, first of all, we want the parents to be 24/7, and then we allow them, and we want them, and we encourage them to do what we call skin-to-skin care. Skin-to-skin care is putting the baby on the mom's or the dad's chest for at least 2 hours, and which in many studies show that it improves the connection, it improves the growth of the baby, the increasing in weight, the production of milk. And actually in developmental countries, it reduced mortality in 20%. So this is, of course, extremely, extremely important. The touch, the connection, induce and release oxytocin, which is what we call the hormone on love, the bonding hormone. And this also released in the mom and in the baby. Now, the main thing is, and what we emphasize, and what I think, and if I go to Hippocrates and I go to what our job as a medical and a physician is, not only having this touch, a physical touch. Okay, the most important, and you talked about disorganized and attachment. At this point, we are in a very crucial time point of the parents, that they are going to be a family. And the connection between the mother, the father, and the baby, this is the time that we are putting an imprint that the way they will start here will affect them the rest of their life. And the rest of their life with the connection with the baby. It's not easy to see a baby that is now hooked to all kinds of lines and maybe not okay. There are risk of sepsis, there are risk of deterioration, and every day is a different day, and they are not really sure. And this is the time that when we are doing the good connection, it will affect the rest of them, the rest of their life. So when I talk about words, I remember there was 2 years ago, I was sitting in my office and suddenly I heard, "Where's Tzipi? Where's Tzipi?" A baby was, and I was looking outside, and then I saw the father, Shimon, and he came with his baby. He was 2.5 years. And this baby was a full-term baby. He was born under resuscitation. We gave resuscitation for 20 minutes. He didn't react. We already, according to NRP, after 15 minutes of good resuscitation, we stop. And we already sent a physician to look for the father to say that there was a problem, but we cannot, he is not reacting to our effort. And suddenly there was a pulse, and we saw a reaction, and we continued. Now, of course, there was a lot of drama afterwards, and we treated the baby. And then I had a lot of conversation with the father, and the baby was okay. He came to visit me, and this was the baby. He said, "Where is Tzipi? Where is Tzipi?" He was running. It was so cute. And the father told me, "You know, I will never forget that we sat here, and you told me, Shimon, there is always hope. We never know about baby's brain. It's continue to develop. There are all kinds of bypass that the brain is doing, and we need hope and we need optimistic, and you take care of this baby and you put all the effort in him, and it will maybe be okay. I cannot know. We are physicians, but there are so many mysteries we don't know, and I cannot say what will happen to him." And he said, "I will never forget it. This gave me hope." And he's an amazing boy. So I don't remember saying that, of course, but we usually, but it sounds like me because I'm optimistic, but the words that we are saying, they are like a scratch in their mind. And especially when we are, as psychology, as a nurse, as a physician, that we are in a position that we are the kind of person that they are lean to, the words we are saying and everything we say, it stays with them for a long time, sometimes forever. So I always say that in our profession we need compassion, and compassion is the art of being professional and human. So professional, it's easy. We study, we have books, we know how to study, but being human is part of the things that we have to emphasize and teach our resident and all our colleagues, that this is the part that we emphasize almost. It's like 50-50%, but it's a lot of importance. So I always talk about the 3 C's, but it's the contact that we need to create between the parents and their child, between us and the parents, and to give them a supportive environment for them to create and start a family. So the contact, connection, and compassion. And it's a 40-second, do I allow to show it? They say, they're doing like 4, 3, 2, 1. It's 40-second short clip of why I come every day with a smile to work, and coming with a smile is the most important, because then you can have a compassion. So I hope it will work. Yeah. Yes, I have it in English. There are 25 weeks, twins, 790 grams. This is Yuvali is 11, 32 weeks, 1900 grams. They all say, thank you. Maya and Ronnie, 4 years old, 28 weeks, 950 grams. Thank you. For giving us life. And this is our word.